Colleagues, it's nice to be back after a 40-hour trek across Europe. But one of the things that impressed me most was the innovation and creativity of my colleagues who spent 2 days on laptops trying to get transport organised and eventually got us home. So well done to all the ladies. Mr. Chairman, colleagues, I am pleased to bring this report on what has become an annus horribilis for our country, our citizens and our public servants. It is a report I would never have expected to have to give. Indeed, I had looked forward in my final years in this position to consolidating the progress made in recent years in a country we were promised would continue to bloom. Instead, we are focused on a country gone bankrupt, on the poor saving the rich, on the sick and disabled being scapegoated to carry the cost of recovery, and on a country where public servants have been singled out for vicious and vindictive vilification. From this union's perspective, I am pleased to confirm that despite the huge number of retirements in nursing and the impact of the moratorium on recruitment, we have maintained our membership numbers. However, we must acknowledge that the continued deluge of retirements will inevitably impact on our membership numbers going forward. In this regard, it is essential that all our branches commit to active recruitment over the coming year. And I'm reminded of the work of Kevin Igo. Kevin came to a training course last year, the year before, and he went back to Roscommon and he recruited like mad, which meant once people are asked, they often will join, but they have to be asked. He even recruited a branch secretary. That was missed, I think. 2009 was an important year in our history as we hosted the official opening of our new head office in Sallins, County Kildare. It was a wonderful occasion attended by a number of our founder members and their partners, who look back on our humble origins and celebrate the success of the Union, not just in our management of our business, but in our achievements on behalf of our members. Undoubtedly, the next few years will offer unique challenges and indeed significant threats. However, we will also be offered opportunities which must be harnessed for the maximum benefit of the association members and patients. One of the challenges arising from the rush to retirement has been the large number of branch officers, of new branch officers, to replace those who have retired or indeed those preparing for retirement. In some of our branches we have an ageing branch structure and indeed maturing branch officers like myself who must recognise the need for regeneration and rejuvenation. We have been critical of those in other unions who have insisted on controlling their branches even into retirement, often long after they have lost a real appreciation of the changing service and the needs of members. The challenge of being relevant to our members is the greatest challenge we face. New branch officers need support and assistance as they learn to represent and defend members. They will often not have the nous of the outgoing veteran, but they will bring a new commitment and enthusiasm. It is important that there is a period of time when the outgoing can assist and support the incoming, so that they might gain from the experiences of the outgoing and build their own skill set going forward. On May 18th and 19th, we will host a training course in the Southcourt Hotel in Limerick. I hope every branch will send delegates. In this regard, I urge you to ensure a big attendance. I want to address the impact of the moratorium and the incentivised retirement deluge currently afflicting our disciplines, especially psychiatric nursing. It has been forecast since 2002, when the Department of Health and Children completed a census of nursing numbers, that a large percentage of psychiatric nurses will be eligible for retirement between 2008 and 2012. The training of 350 students per year was meant to address this shortfall, and this number has since reduced to 300. Many of those who were trained are now seeking pastures new. due to the government recruitment embargo, pastors in Australia, Canada, and the UK. A vision for change envisaged a new service in which there would be a requirement for approximately 3,700 psychiatric nurses, and this figure was based on a greenfield site, but did not allow for the numbers of patients still in the system from the days of institutional care, nor indeed some of the services we have historically provided but not envisaged for our future services, nor did it include any built-in replacement factor for sick leave, maternity leave, annual leave, etc. We now have local health office managers who are taking the recommendations from Vision for Change and applying the recommended staff quota on the basis of population, not to provide a modern service, nor to respond to the actual needs of the service, but to cut nursing numbers irrespective of the number of nurses required to run the service. We now have a system where the approved complement of nurses is nowhere near the numbers required to service the needs of patients on a daily basis. And as a result, our services are manned by overtime, agency nurses and retired nurses, while our newly qualified staff seek out jobs in Australia. Today we all realise there is a serious lack of appreciation of economics in those who have been charged with managing the economy or the economic well-being of their banks and businesses. The experts appointed by government also failed their rudimentary responsibilities to oversee the safe management of the economic well-being of those under their remit, and as a consequence have damaged the Irish economy far greater than might have been the case in the face of a worldwide recession. When I look at the policies of the Department of Finance, Department of Health and the HSE, I'm left with a sense that nothing has changed. Our managers are still deluded. They inhabit a world where facts are replaced by fantasy, where primary school arithmetic is replaced by the logic of the three-card trick. Consider the following. You work in hospitals or services where you can count the number of staff required to provide care to patients and to the community. Yet you are told you're in excess of your approved complement. Your complement seems to be a movable feast. It is not the number required, but the number assigned. It is not the number agreed in negotiations, but the number imposed. Your complement is not based on any science, but in fairness, the agreed complement was rarely based on any science either. However, the complement now imposed seems at times to be plucked out of the air. In some services, the approved complement is based on a greenfield site, where there is no pre-existing patient's services, but posts are allocated on the basis of population. That is, someone's calculation of the number of staff that would be required if we were starting now to provide a service to a new population. There is no provision of staff to care for those patients who have been transferred to the community from the old institutions and who still need care. And there is no provision for those patients who are mentally handicapped or intellectually disabled who are still being cared for in that service. As a result of the staffed system, our directors of nursing are constantly told that they are over budget. And yet they in turn are being attacked by us for not providing enough staff. Last year we know that nearly 700 psychiatric nurses retired, yet the HSE tells us that the number is 440. Many of us have been trying to understand this. How can this number be so understated? And more importantly, why? We are now aware that in some areas, if not all, the numbers recorded have been limited to a quota. The question is why? And just on that, we're trying to get the exact figures, and many branches have sent the figures in. We're required to finalise that. But we have 40 services. After counting 22, we have 416 retirements. And they say the total is 440. It's just not possible. We have long accepted that the Department of Finance is not concerned about current expenditure. That's extraordinary to say. The Department of Finance is not concerned about current expenditure. They insist that staff cannot be employed at the minimum of the incremental scale. So you have a newly qualified nurse and they go on the 0.2 of the scale if they're employed. Much better